abodafo ne Takoradi de waja afa oye yam bridges we ya le uba head ya kuma fon wonam di ade be sana abodafo nkote ubu ase ade le cha abodafo ubu ase o dem po so bi no fimpo no hu dem pa obosuo ndi se Takoradi no ya abodafo nkote waji ko na afa bebia ya abodafo bebia abodafo woni ne maani nti na ya sra won wontunu wana mo no me no bu ono so lutu kwa no ko sia da mani ye mbese ata asa nti won bo ene hu ko na be foda yebotu abodafo no ona ase se mbo ebi won pa yenya betu ya ngaka ni apebebi ni akwon na egu ni ahwe na atoto no mu ayi yakre eje wo mu da ma abodafo ko betum so akwose obi na ade ni 3 days na abodam ni de mu do da abobas mu ase no ata asa nti yesna won ni wudu mama
Washara wa no matambo wa kwenti watina wonpa na waleda nti ruchom na ahwe won yegutu wajada abo waruko police station pa obaye na free case obaka na adwene ye adwuma na jade no shira ede pront na na yan hye na ma ye bo hwe won ye won da munkofo no oda aba na hwe bebi na ne won gu ana so sa obi pada osa na yeleba ebi wo ye abodam no wa abona me da me yam na ono mininti ni se bunya bushia no bunya aba ne bi na won bakasa de mo ye na on bo hon da chi amano wa da yi wo mana nti se da munkofo ya wose ya na ye mpemfu wo wanam ana ye ne won bisa na me na ye gbuma no tinan da aba no so ogun da munkofo mo bo na wo ye no wasan ye ba won so wa adwene no oye hegege no so na won na akasa da me nya on bo yen na ye hu okwana ya me bo hwe na ne na afado
bebre hiamwa nyo especially one intelligent one didim na de obi o ha yen nyina na sabi o oye empama na mom no oye efi adwenwen bebre esutum ka ho yo ha industry nyina asa hiamwa bi wo ha wo hiamwa papa asa ka bi mo wo sika ka ose da wa ya doye mo wa ebi mo nye wo bi ose wo de bo bi no bi mo nye ti se nya akoma pada de bobo bi a so ye hira kase ti se do tu akoma de so na ebi agina de obotuma aye bi abo bi no ma ka so beboa
obo na da me bia obi na mbe bia na wo ma de bi do do bona obaka da onam da wa abodam ni nti won kasa na wa ka fa program for shama nti ode ye mpanyifu wo boa na mpa wati da na wo chire wo tu mo akwo won ma also any baby
government no do share because echo other countries na baby now do one psychiatric hospital you know when you now so na wa abodam ebi wa depression iwa ne mental health hint ebi wo hia kasa ebi on board am but on the adwin amanhunu bi a wa fem no wa mo aba ne den nti ayen so NGOs no ebi so betuma support an ko beboan.
Yes, it is because some of the mentally challenged persons find themselves as part of the disabled group, and some are not part of the categories because in the PWD manual, they list the number of people that are supposed to access the fund, and in that group we have bipolar. That is a mental health issue, but the rest, in terms of any other condition, they are not stated. So sometimes when you want to go out of your own way to help other mental health groups, you get auditors trying to disturb you because sometimes the money, when they bring, they spell out what it's supposed to do for the disabled. And so when you try to extend it to the mental aspect, it becomes, if it's not, they don't fall within the group, it becomes a problem for you, the officer. So I think with time, since they are also vulnerable, they should be added to the list of people that should have access to the common fund, such that as a department we will not be limited in giving some people some help and some others neglected. Initially, we had Abiba's shelter, and we were always liaising with her. Sometimes we send them, sometimes when we get mental issues, we call her, she comes to assist us, especially when it has to do with the mother and child. she takes the mother into her shelter, and then we take care of the child because we don't have a place that the state has provided apart from Ankafo, which is really difficult when it comes to the monetary aspect. So mostly we liaise with her when she was alive to do that, in order to keep the mental mothers who may not have anybody to care for them. She takes care of them, she feeds them, she bathes them, and we send the medical team sometimes to attend to them there. But now that she has passed on, the only reliable source for us is the Ankafo. And Ankafo is very far from here. And the amount in question, in fact, the district may not be able to afford. And so the little we do when we find mental health is mostly, as a department, we try to trace relatives. And when we trace relatives and we find that the relatives are people who can help us help the mental patients, then we try as much as possible to educate them on how they can help us help the mental patient. Apart from that, it's quite difficult, I must be honest. It's quite difficult for us to really handle a case on our own.